Good afternoon. My name is Amber Moyer from the University of Colorado, and today I'll be presenting a dedicated feeding tube clinic reduces emergency department utilization for gastrostomy tube complications. I have no disclosures. Over 216,000 G-tubes are placed annually in over 24 different patient conditions utilizing products from 12 different major manufacturers. These tubes can be placed endoscopically, surgically, or radiographically, and they carry a wide range of complications. Despite the widespread use of G-tubes, routine follow-up with the proceduralist is rare, and patients often rely on the ED for complication management. Each G-tube placed carries a lifetime accidental dislodgement rate of 12.8%, averaging $1,200 per ED visit. We developed a dedicated G-tube clinic to provide longitudinal continuity of care for patients with G-tubes, and hypothesized that patients managed in this clinic would have reduced ED utilization for G-tube complications. We conducted a retrospective review of patients who underwent G-tube placement between January 2010 and January 2020. We then compared two groups, those that received G-tube clinic care and those that received the prior standard of care. To elaborate on the G-tube clinic, it was developed in June of 2016 as a multidisciplinary clinic staffed by surgery residents and faculty, dietitians, nurses, and a wound care team. At each visit, the surgery team performs a focused physical exam addressing G-tube issues and also performs a prophylactic G-tube exchange. Patients are provided with a replacement tube to take home in the case of accidental dislodgement, and they also receive education on nutrition guidelines, as well as tube care and troubleshooting methods. Lastly, they receive 24/7 contact information. The results of our study include 97 patients, 16 of which were managed in the G-tube clinic. Tubes were exchanged an average of 7 times per patient in the G-tube clinic group versus 3 times per patient in the standard of care group. 19% of patients in the G-tube clinic group required ED visits for G-tube complications versus 54% in the standard of care group, which is an average of 0.9 versus 1.6 ED visits per patient. As you can see in the figure on the right, the most common ED presentation was tube displacement at 34%, followed by malfunction and leakage. Those managed in the G-tube clinic had no visits for broken tubes, infected tubes, or leaking tubes. In conclusion, the high rate of G-tube complications in combination with the lack of standardized care guidelines and the involvement of multiple specialty teams often leaves patients confused, and they rely on the ED for G-tube complication management, which is a costly burden on our healthcare system. Our study is the first to detail a dedicated G-tube clinic to provide comprehensive longitudinal care for patients with G-tubes and ultimately reduces ED utilization by over 50%. This type of clinic should be considered at all facilities that care for patients with G-tubes. Thank you for your time.